So, welcome everybody. The first thing I want to have you guys do is just take a moment and introduce yourself. Talk about who you are, use your name that you want to be out on YouTube, and to be able to talk about why you're here. So we'll just kind of go in order. So we'll start with Susan and then we'll end up with Lucas.
Okay, so I was going to say I want to be known as Miss K, but that's okay. So my background is in working in education. I am a faculty member for Tarzana Treatment Centers College, and I do have previous experience working and teaching substance abuse and parenting classes in the Orange County jails, as well as working with the Orange County Needle Exchange. So I have worked with a lot of people who are active in their addiction to opiates and other drugs, and actually currently homeless, some of them as a result, as well as others who do have nice homes and live in upper middle class neighborhoods.
I'm Olivia. I work in outpatient services. Prior to COVID, I used to be a behavior technician, so I helped kids with autistic children and with special needs communicate and learn, life skills. So I taught some life skills sessions. What brought me here is because I just love helping people, and I figured, there's something new, and I could always help anybody in this situation and understand the struggles that people encounter. And now that I can understand that it is a disease, and I can connect better with people and tell others, hey, we need to change our mentality in order for us to help.
And my name is Lucas. I'm a medication-assisted treatment counselor with Tarzana Treatment Centers, and I'm a former case manager, cask assessor, intern, volunteer at the Syringe Exchange in Skid Row, Los Angeles. I worked there for about 3 years in all those roles, and it really just opened my eyes to the field of addiction and made me want to go to school more for it, work on my psychology and counseling and addiction studies and all those things to help people with this big issue.
Wonderful. What are needle exchange programs? And I think there's a lot of people who have questions around when they see syringe exchange or needle exchange, what does that mean? And what are we actually talking about?
I think at its most simple, it would just be a site that collects used syringes and gives out clean ones in return. Usually they have a lot of other services on site, like case management, HIV testing, any other kinds of supplies that would help use safely or connect people to treatment, anything like that. But it can vary.
Good. And so then what are needle exchange programs not? What do they not do? What do they not cover? What are the things that they're not meant to do?
Did you want to
No, you
say?
could do it.
I mean, there's some myths and misconceptions that they're not there to enable people. They're not set up to judge. They're not set up to, put people kind of on the spot. It's more of a safe place that treats all the clients with respect. But it is not just a place to hand out needles and, again, enable people to continue to use or attract new users.
And that's a really good point. Were you going to say
Yeah, I was
something?
going to say, so in the way that I understand it, it's just like a harm reduction. It's reducing the risk that is entailed when it's drug use, and it's particularly intravenous. It helps us curb other things that could happen for drug users.
Good. And I think when most Americans hear needles and drugs, we're wondering what kind of substances are usually people getting needles to inject? Like, what kind of drugs are people
It's like
usually
opiates,
injecting?
methamphetamines. I've heard now that you can inject cocaine. I didn't know this, but so I'm learning. But it's these harsh drugs that are already risky in itself.
Oh, and one thing I will add is that a lot of people say, well, why are people injecting these drugs? And if you think about someone who is a chronic user or even, just need to, the highest high you can get is putting something directly into the bloodstream versus alternative methods. So that is one reason why people will go to needles is after being a chronic user, if they develop tolerance, and some of those other methods also aren't necessarily giving them the effects that they might be seeking, they might move to utilizing needles.
And also, in addition, where I worked, I definitely saw mostly heroin, meth, some cocaine. But there were also people with diabetes who would come in to work with their insulin. There were people who took hormones, lots of different things. Anything, if you can mix it with water and inject it, then you could use a clean needle to do it.
Good. Lucas, you've worked in a syringe exchange program. Can you walk us through what a day in your experience was like in one of the programs? What are some things that you might have seen or done in one of these programs?
So you mean like as a worker or as like a participant? What would it be like for them?
I would say, as somebody who works in a syringe exchange program.
Okay. So I would usually come in pretty early morning. We'd open up, get set up, make sure everything is sterile before everyone comes in. So I'd be over at the front desk. People walk in through the front door. We had a security guard over by the door. We gave out water, so if someone comes in and they pretty much walk right up to the front desk and say, I want needles, or I'm looking to get into treatment, and from the front desk we can kind of decide, are they going to go in the back, are they going to meet up with a counselor or something, or for an assessment, or if they're just going to get a bag of needles and supplies on the spot, then it's a really quick interaction. They're on their way out the door. But water is, again, like always available. That was a really big thing, especially in an area like Skid Row where there's a lot of homelessness. Just having water or a bathroom is really important. So, through the day, you're just kind of sitting up there, taking people one at a time as they come. They're changing their dirty needles in for the clean ones, and we're kind of giving an estimate of about how many they're bringing in. And by the end of the day, we gotta close it up. We gotta put the stops on everything.
Can I share a little bit about the one in Orange County, just real quick? We actually took tables out into the community and we would set them up like an assembly line. So we had volunteers, and the first stop, people would wait in line with some space, and we'd have a big receptacle for the dirty needles. And it was a huge sharps container. We'd ask the clients to put their needles in. Then we'd give them a bag so they could get new supplies. So it was an assembly line where they could get needles, other supplies, water, sometimes snacks, as well as if they wanted some, we had condoms, all kinds of different safety items, if you will. And then we had referrals, so we'd have someone who would give out a flyer with local resources, from everything to food and housing and work, and also have available representatives to do HIV testing, Hep C testing, flu shots, and then Narcan. So individuals could get trained on how to use that, and ask any questions on any other services that they needed.
What are some of the issues that you guys see with syringe exchange programs that could be harmful to the community?
Leaving not bringing the same amount of syringes that are given out as trading in for clean ones. There might be some of them left out, and you could find them. Sometimes you're walking down the beach and you see syringes and there's kids involved. So there's concern about, external communities that are not using drugs that might be at risk if somebody touches the needle. There was incidents where needles were found in playgrounds, in the sandboxes, where they had to close out these places. So that also takes away from the safety issue and then requires more taxpayer money in order to clean out that infrastructure.
Right, you brought up a great point, which is that needles that get displaced all over Los Angeles, and if anybody has ever worked downtown, then you guys have probably seen some needles on the streets, or if you're down by the park, and you know what park I'm talking about, then you'll know that it's not uncommon to see needles out. And we are wondering about the rapid spread of infectious diseases in America. Tarzana Treatment Centers is a public health organization as well, and so we're also concerned about those issues related to how diseases are transmitted. And one of the ways that we know that hepatitis and HIV is spread is through injectable needles. And that can be a previously used needle, it could be somebody accidentally is stuck, a police officer may be stuck by a needle. And I'm wondering, what are your thoughts around how needle exchange programs fit into that idea of spreading diseases?
I think it's just the regulation of the programs itself. If you don't have the staff properly administering the release of clean needles and the intake of the clean needles, then it's not going to work because it needs to be implemented. Also, in availability, if certain counties are against it, then that means that those services are not being provided in that county. And they might go to different counties, but then there's no regulation on that because they go back to where they use in their particular counties.
I was just going to say, a big complaint is, communities saying there's a lot of needles left around, they're uncapped, it's dangerous. Well, there's a couple reasons why that might be happening. It is legal to carry clean needles, and dirty needles, it is legal to carry them in a medically provided, sharps container. However, sometimes law enforcement is not aware, or they will cite people. So in a lot of places, there's no public disposal bin. So unfortunately, if they don't have their own individual container, they may, just dispose of those needles wherever because they're afraid of being cited for that. But most needle exchanges, do have staff that what they do will do sweeps regularly in the community to dispose of any needles that are left outside of those sharps containers. And city workers will help with that sometimes, but mostly the needle exchange staff is responsible for doing sweeps from time to time.
Definitely, yeah, right. You can see a lot of publicly disposed needles, but the syringe exchange is really supposed to be that disposal site where you bring them and you give them away. Or, you keep it from going out into the public, from going in the trash even, because like you were saying with the parks and sanitation workers, when sanitation workers have to empty trashes, and they're just light bags, right? So a syringe in a plastic bag is still going to poke through. That's still a health hazard for sanitation workers. So like Susan was saying, it's best for them to be in a sharps container, or something puncture proof. So that's what syringe exchanges offer, just in terms of what they are as a site. And we give out sharps containers all the time. We tell people you should cap your needles before you put them in the sharps even. Just be as safe as possible. That's where you get that kind of education.
And I will say that most of the time when people do come to the exchange, I'm really impressed their needles are capped.
Mm-hmm.
I have not seen, in my experience, many where they were not capped.
Okay. So there's studies that have shown that needle exchanges attract high-risk drug users. and that many of those users have a lived experience with the justice system, which could impact the amount of crime that is around these areas. So I want to talk about in Los Angeles County, where are these needle exchange programs usually placed? Are they in Beverly Hills? Are they in Santa Monica? Are they in Tarzana? You know, where do you see them at? In which communities?
Lower income communities, disparate places, you know, high violence areas. So it's kind of, for me, it's counterintuitive because you don't feel safe going to get this stuff in the first place. And it's not safe because there's a lot of high stress. There's a lot of factors that don't get taken into consideration. The reason they're using is probably they're trying to numb themselves from what their environment is.
Yeah, I'd say, you know, it depends because I've seen all walks of life walk over to the needle exchange. I've seen, like I mentioned, people who are homeless, to parents, to people dressed in suits. So as far as the crime, I would you know, want to share that it does not increase crime. You know, when people have supplies, when they have education on safe use resources, they're very, very respectful of the needle exchange. This is a source of support for people. And so in order for them to continue to get those services, we need to ensure that the community is safe and that people are respectful of it. So, you know, it's tough to say because, again, if they're located in neighborhoods that already might have high rates of crime, then it's not fair to say that the needle exchange, the consumers, are contributing and making it worse. In fact, we're in there trying to offer them some healthy solutions and resources.
A quick search of the biggest needle exchange programs in Los Angeles were in the following areas: South Central, East LA, Eastern Los Angeles, Downtown LA, Koreatown, East Hollywood, and a couple of Valley locations. Does that reflect a certain population of Los Angeles County to you guys? And how is that impacted by crime rates and by the ability for people to have access to more needles?
Well, I would say the syringe exchanges, if they're being allowed in a community, they're responding to a need. So those communities must have had the need for it. And while we're not really hearing it so much in Beverly Hills, like we were saying, we would hope that, or think that probably those people have the means to go to a needle exchange, can get in their car, go get what they need, or can pay for it from pharmacies, because you can also get those things from pharmacies sometimes, or your doctor, if you can pay for it. But the point of a syringe exchange is to be free and to be to the people who need it, so that people can walk in and just have it.
Given that these areas are traditionally areas where people of color are highly concentrated, whether they're Black, brown, or Asian, does this send a specific message to the community about drugs?
I do think that it sends a specific message because it does not entail the broad picture. The broad picture is it doesn't matter what race you are, you can become a drug user no matter what. But if they keep it within those communities, it distracts everybody from the reality, and it prevents the actual help that is needed. And because of that, the people that are in those communities might not go even use it because they don't want to be stereotyped for that specific purpose. Because they already have high rate of crimes and they're blamed for it already. It's not like they're not blamed for it.
So, Olivia, you're talking about this idea of optics and what it looks like to have these syringe programs in communities of color. And when we talk about that and we talk about the history of American SUD, one of the biggest stains on that is what happened during the crack epidemic in the late 80s and early 90s in Black and brown communities that were highly urban, like Los Angeles. And so I'm wondering, do you have any thoughts, and this is for everybody, do you have any thoughts around how the placement of these syringe exchange programs either perpetuates or supports some of the devastation that happened during that time?
I think it is continuing that route. Basically, if you thought about the history of the crack epidemic, from a documentary that I read and that I saw, it was based in New York and New Jersey, the area, when the big epidemic happened. And it wasn't until not just colored people were addicted to crack that it was actually white people coming over to New Jersey and New York that became a problem, because the crack dealers were actually benefiting and they were selling the crack cocaine to these people at high rates. They were getting financially wealthy, they were having a successful lifestyle based on this. And when that happened, it was now a shameful act. And how can you be doing crack? How can you distribute this and kill people? So it was not addressed until it started affecting white individuals and high-class individuals. It wasn't just your normal white person that lives within the minority place. So now when you put these particular needle exchange programs in the lower minority communities, it's sending the same message. It's sending the message that only those particular people are suffering from this. But we have celebrities that are overdosing. Amy Winehouse suffered from this. They're musicians. There's multiple musicians, multiple actors who have overdosed on these particular drugs, but it's not being addressed in that way. They're like, no, there's not that much addiction, but in these minority countries, that's where, in the minority counties is where the problem is and exists, and that's why we have to put these programs there, which I don't feel it's helping.
Do you guys believe, and you brought up a really great point, that Hollywood, and we're in Hollywood, Tarzana Treatment Centers College is located in the center of the San Fernando Valley. And so we're right here, we have a lot of celebrities who live in Tarzana and in Woodland Hills. And we know that there have been so many celebrities out here who have been addicted to substances that they, put into their bodies through needles. And should there be needle exchange programs in Calabasas and in Woodland Hills and in Beverly Hills? What are you guys' thoughts about that?
Definitely. I mean, they should be accessible to all the communities within reason. You should be able to find it, whoever you are, whatever background you come from, whatever neighborhood you live in. There should be one within reach, and that especially applies to rural communities throughout the whole country. It's very difficult for them to have access to these same things that we take for granted here in Los Angeles County. There are so many spread out. And also, another confounding factor here that I was thinking about was the mobile sites, because we don't really know exactly where they're going because there are so many. And that's another good intervention for the rural communities and here too, to bring it to communities that don't have a fixed site.
I was going to say, a lot of times you probably don't visually, you wouldn't see those needle exchanges because people in those areas, their socioeconomic status is such that they have access to health insurance. And so, as far as being able to purchase needles from a pharmacist or even the naloxone, much more accessible for them to do it that way. And even though they might be, getting prescription medications, we also know that what will happen is people will crush those into powder, mix them with water, and also inject them. So again, the optics is something that is very, very, very deceiving. We see in the news a lot of these, maybe meth labs. What at least my experience is when I see who's being arrested or who is organizing and manufacturing are white males. The crack epidemic today, the most recent research that I've done is that the population that uses the most crack cocaine are males late 30s, early 40s, where we really have, again, the optics from the war on drugs is black urban youth and crack babies, and that's just kind of the images that we see, but it's very deceiving from reality.
Yeah, I think that's a really good point. And many advocates of syringe exchange programs believe that it's important for us to look at some of the positives around having these programs in our communities. And some would argue that the risks outweigh, the benefits outweigh the risks when it comes to these programs. What do you guys think are some of the most important reasons why needle exchange programs should exist in our community?
I think to prevent overdoses, to prevent the spread of HIV, and especially to clean up syringes in the community. I know it's a very common worry of people in their communities that they don't want to see it because they don't want to see more syringes on the street. But ideally, the purpose of the program is to clean them up off the street.
I think, one thing I wanted to say is I think it's a way for people to connect to the support that they need. Addiction is about isolation and stigma, and recovery is connection. And so a lot of times these needle exchanges, there's people who are very respectful and want to see them through to be, you can't expect everyone who's going to want to seek treatment, but the idea is to connect them with resources and to show them opportunities. So I think one of the biggest roles that needle exchanges play is education and awareness of harm reduction. And that this is a way, we use harm reduction with seat belts, with nicotine patches, or even, the vape is an alternative to putting tar and chemicals in our lungs. So we practice harm reduction in all different ways, and this is education. There's a lot of stigma about addiction, but our mental health statistics, 1 in 4 people at some time in their lives, and I think that's just what is reported. And I challenge people to, every single person knows somebody who has suffered through some kind of overuse or addiction, and we need to educate people that they're okay and that there's help and there's resources, whether they're ready or not. So I think that's the biggest thing.
Yeah, I want to go off of that education part, because it's not just the user that needs the education. It's the population, it's the communities, because if the communities remain ignorant, it's not going to progress, because they're scared. The moral values is going to outweigh the evidence-based information that is out there, that it does work, that you can save a family member if you open your eyes to what information is out there. There's information out there everywhere on how drug addiction is not a choice. It's not a choice. It's a disease. So unless we all come together, we can't fight this battle, because we remain ignorant.
Both of you talked about some really good points around the community, which is a major core value of Tarzana Treatment Centers College. And the word that I heard Susan use was stigma. And we know from being at Tarzana Treatment Centers, one of the leading organizations for behavioral health, for integrated care, for MAT, for SUD education, we know that stigma is a major issue. And so Lucas, I'm wondering, what do you consider some of the biggest myths about syringe exchange programs? And how would you convince a mother who is worried about having one of these programs in their community that it's beneficial to have it?
Well, I've seen a lot of these stigma opinions posted, I'd say, on Nextdoor. A lot. It's a neighborhood app. I see it a lot in my community. I live close to Burbank. It's a lot of wealthy homeowners, and they, like we were saying earlier, they really just don't want to see drug users attracted to the community. They don't want to see crime. They think that they connect all of it to the same thing. Like every drug user is homeless, doesn't work, doesn't contribute to society. They must have the worst possible addiction. So there's no spectrum. And there is a spectrum. People are using maybe a little bit at the end of the day, maybe they're using all day, but it's not all the same. So for me, convincing people to approach this from a place of compassion is really just trying to get them to open up to the idea that everybody is different. Every single individual is a different person. And you need to approach it on that level. When you hear about these large issues, it's made up of individuals who are from completely different backgrounds. And when you have a single place, like a syringe exchange, where they can come and get some services, be treated with dignity, which often a lot of people who are homeless or who you can tell are using drugs, then they're not treated very well at most businesses or places. So just to have a place where you have people who care about you is crucial. Like we're saying, community building. We want to see everyone feel that they have a place where they can feel safe. So if you can build those relationships at the syringe exchange, you're also providing the opportunity for a transitional space for somebody to say, hey, you know what, this is the person I feel comfortable coming to and saying, I need treatment. It's not an easy thing to do, especially with families. Sometimes people are afraid of being ostracized from their own family by admitting to drug use, and they hide it from their families. You don't want to talk to your friends about it, and maybe you don't want to come to a place like Tarzana Treatment Centers because you don't know anybody there. But if you go to a syringe exchange and you have someone who you know, who treats you with respect and says, hey, you know what, I think this could be a good place for you to go. This could be a good next step for you. This is another place that I think you'll also be treated with dignity.
I want to speak on that, just being a mother. I think the worst thing that a mother could ever picture is their own child having a drug addiction. But if you can relate that to them and just picture their child using the drugs, and would they want the help out there because you couldn't provide it, because you don't have that needles and you don't know how to do the particular education on how to stop using. So connecting as a mother with these individuals that are already suffering from this is a way to connect, I think, the understanding on why it's important that we have these resources available.
You know, my son, when he was 15, he wanted to volunteer at the needle exchange, and you have to be 18 to kind of work the needle exchange, but he was very excited. He kind of tagged along, and he greeted people, and he wanted to help them with the snack portion. And you know, he said that it was a really good experience, and he said, Mom, they're people just like us, and I'm glad that you do work that helps them get better. And I think if people are open and they visit and they connect with the people who come to these exchanges, we're all people. We all have our things, and get to know people's stories instead of judging them for maybe their behaviors or what they look like. I think that would make a lot of change. And as a moms, you know, we want our children to respect others and learn that there are people who are going to be different.
Definitely.
Tarzana Treatment Centers has been on the cutting edge of syringe exchange programs for over 30 years. And we've been a leader in Los Angeles County for these initiatives. And our students at Tarzana Treatment Centers College Substance Use Disorder Certification Program get the opportunity to dig into harm reduction as a viable tool to help save our community. If you could leave one last word with our YouTube audience, what would you say as a call to action to listeners, to the community? What can they do to support these programs and to support the people who are dealing with this medical issue of substance use disorder?
I would just say get educated. Go, just like anything that you seek, it's important. Make this a priority, make this an importance, because it is our community. It can be your family at one point. So just be open-minded to the possibilities of having new knowledge that can help.
Yeah, I love that. I think education, and just ask the difficult questions. Instead of making an opinion of someone, you can ask people about their addiction. They will tell you. They will tell you. Don't let it keep you away from getting to know people. Educate yourself. You can ask people who have a family member who's in their addiction. Don't shy away and judge. Just open your mind, as you said, Olivia, and ask the questions, whatever comes to your mind, so you can learn more about the people in your community.
Yeah, and I would say to volunteer too, spend some time. Come through, take a tour, donate some items. Clothes are always necessary, food is always helpful. Any kind of hygiene supplies that you use in your normal life, other people need it too. So go on and just drop off some stuff and see what you see. Just experience it, see what it looks like.
Thank you. Well, on behalf of TTC College and Tarzana Treatment Centers, we want to thank you guys for being on our inaugural podcast episode. And we're very proud of the work that you guys do in the community, and so excited that you guys took the time to come talk to our viewers today. So thank you so much.
Thank you for having us.